Obese people now have a new weight loss option, bariatric surgery, a minimally invasive technique that restricts the size of the stomach. Dr. Brian Quebbemann is a surgeon who has performed the operation. Among his patients, Ann Wilson from the rock group Heart. Dr. Quebbemann, good morning.
Thanks.
We've heard about stomach stapling, gastric bypass. Tell me how this new surgery compares to the gastric bypass surgery.
Well, this new surgery is used for the same people that the gastric bypass surgery is used for. I think the main difference is that this surgery doesn't involve any stapling or cutting of the stomach, and there's no malnutrition. You can eat basically anything and everything. You just eat a smaller amount because the procedure helps you control your portion size.
Let's talk about the procedure. We have a little graphic showing this. How invasive is this surgery?
Well, we put it in using laparoscopic technique, which is minimally invasive surgery, and we don't really alter your anatomy at all, except for the fact that we put this band around the stomach, and it creates the stomach into an hourglass configuration where the upper part's small and the lower part's larger, and the food then goes through from the upper part to the lower part slowly, and that really decreases the amount you can eat, makes you feel full sooner and satisfied with a smaller portion.
We have one of the lap bands right here. Can you show us how you can, hold it up for us for a second there,
Sure.
if you could, and show us how you can make it smaller, bigger?
Well, the stomach, this procedure wraps this band around the stomach, and the band is then adjusted to control the opening from the upper part to the lower part, and if you inflate the balloon a little bit with some saline, it'll tighten up that opening and then slow food from going from the upper part to the lower part. And so it just, you can adjust it so that it's tailored to that specific patient and their eating patterns.
How much weight can people expect to lose from this procedure?
Well, the way we talk about it is, we talk about it as excess body weight. So we talk about the amount of excess body weight a patient has being equal to their actual body weight minus their ideal body weight. And ideal body weight's pretty thin, medically speaking. So what we do is we look for a weight loss of at least 50% of the excess, which with many people is 50 to 100 pounds.
What happens, you know, many people who are in the position of being obese, it's because they just eat too much. What happens if after you get this surgery, you overeat? Well,
you really coach patients prior to doing the surgery, and that's very critical. And then afterwards, patients, if they need some more reinforcement, they'll speak to their physician or support groups. But what they do is they chew food really well, and they take a couple of bites, and you actually feel full. You feel like you've eaten a large meal. You look at the plate, and there's a small amount there that's gone, and the rest is still present, but you feel like you've eaten quite a bit. And so it's really, our psychologist calls it the most holistic surgical weight control procedure available.
Ann Wilson from the group Heart has had this procedure done. She had some comments about it. Let's take a look.
It's a very beautifully simple idea that takes nothing away from your natural body at all. It just helps you. It's a tool.
How much weight has she lost?
Well, she's lost about 50 pounds so far in 5 months.
What are the risks?
The risks are really the same risks with any general surgery, similar to the risks for doing gallbladder surgery. The risks of anesthesia, the risks of injuring something while you're putting this device in there. You eliminate the risks of leakage or minimize the risk of infection that you get with a bypass. That's one improvement over the bypass. The surgery is fairly short, and we've even done it as an outpatient.
When you lose the weight, does that come out?
Nope, that's in there for the rest of your life. You use it as a tool. After a while, you essentially forget that you have it.
All right. Dr. Quebbemann, thank you very much for being with us.
Thank you for having me.